Thank you, Mary. It's my honor and pleasure to introduce Dr. Traci Wolbrink. She's a pediatric intensivist at Boston Children's Hospital and associate professor of anesthesia at Harvard Medical School. Her academic interests include developing and studying innovative online educational strategies. She's a co-director of Open Pediatrics, an open access online learning program for healthcare professionals, and the co-director of the Boston Children's Hospital Center for Educational Excellence and Innovation. She also serves as course director for the Harvard Macy Institute Transforming Your Teaching Using Technology course, and as the education chair for the World Federation of Pediatric Intensive and Critical Care Societies. It's our pleasure to have her here today and for us to learn more about how we can use AI in our pediatric education. Thank you.
Great. Well, thank you, everyone, for the kind introduction and for the warm welcome. I'm excited to see so many familiar faces in the audience and be here with you today. I wanted to maybe start, and I'll ask you a poll in just a moment, but I want you to think about how you might be using AI today, if you are, and how you're using it. And we'll kind of go through that as soon as this turns out. All right, I do have one disclosure. We currently have a funding from the Celiac Disease Foundation to develop a program called MedTutor, which is a large language model enabled medical tutor. I'll be sharing a little bit of that work here. It's in its early stages. And one other disclosure is that this currently reflects thinking and processes in January of 2025, and this is likely to change dramatically over the next few years. So I just wanted to start, and I can see the people in the room. So start with you. How many of you are using artificial intelligence or generative AI at all for any purpose? All right, quite a large majority of people. How about for fun? Anything? All right, maybe for some professional kind of work, personal assistant kind of tasks. Few more hands. And how about for teaching or learning for your learners? A few, handful? Okay, so kind of a big mix of people that have started to try it and maybe some that are perhaps a little bit skeptical of diving in there. And I would say that this is usually the reflection of the audience that we typically see. And one thing we think about is sort of the law of diffusion of innovation. So in the 1960s, sociologist Everett Rogers looked at marketing and sort of found that there were distinct people that would consume products. And there was these innovators and early adopters on the left-hand side. And this is kind of maybe where we are moving towards the early majority in terms of artificial intelligence. So people that believe in the why really want to be there when things start and get involved and get excited about it. And you know, this is like when a new phone comes out and everybody, there are some people that go and wait in line for the new phone to be there. There's others that don't want to swap over from their existing phone for many reasons. And then finally at the end, you know, there are probably maybe a few that have an old flip phone without any sort of technology. And those might be sort of the skeptics. But I feel like in the AI space, you know, we're sort of moving past the tech enthusiasts, breaking this chasm into the early majority and starting to think about AI in that space. So as we think about artificial intelligence are just simply techniques that allow the computer to emulate human behaviors. And many of us are probably using this every day as we use things like Siri, if you have an iPhone, Alexa in our houses. Many of us are using things like Grammarly or some of the auto-suggest in your Outlook. All of these are examples of artificial intelligence. I'll be focusing a little bit today on things like generative AI, like ChatGPT. I have no stock in ChatGPT. It's just one that I've used, so I'll share a couple of examples from there. But there are many other tools that do the same sort of thing. And as we break down artificial intelligence, there's larger sort of overarching structures, and then it gets more granular as we think about some of the tools that we're most talking about today, these generative AI tools. And so in addition to the artificial intelligence example that I gave earlier, machine learning is a subset of AI, which uses algorithms to try to use techniques to study large amounts of data sets. And when we go further into that, deep learning actually deploys a neural network to sort of start making sense in multiple levels of different types of large data and bigger data sets. And when you go into generative AI, this is where those large neural networks can start generating text and images and graphics. And beyond that are large language models, which can emulate human behavior and language. And finally, the GPTs that we sort of think about. And if you break down what GPT stands for, generated pre-trained transformer. So these are going to be techniques that generate text or content. They've been trained on large amounts of data, and they transform processes to predict different outcomes. And the chat part comes from the natural language course, or sort of iterative processing and natural language processing. If we think about how these models actually work, they're quite complex, but they're basically big predictive models. So they take a sequence of words that have been given, they put it through this neural network and large language model, and then they predict something at the end. So the color of the sky goes through the model, and 91% of the time is going to be blue. People are going to look for an answer that's blue, but it might be gray, it might be pink, it could be different things. And what these models take into place is they sort of consider probabilities of what people are expecting. These models want to please us. They want to get the right answer so that we're happy with these models. And so this is an example of Google's PAIR initiative, so the People in AI Research Initiative, that kind of exposes what's going on in some of these models. And so these models take tokens, which are short bits of information, usually words or small phrases of words, and put them together. And with these neural networks will allow them to predict something else. And these get larger and larger and more complex as we've been developing these models. But as you can see here, to be or not to be, that is the question, the problem, the truth, the dilemma. There's a different probability for what we would expect to be coming from here based on the models that are trained. And I think it's important to mention that, you know, these tools basically just hallucinate, right? They're not picking something and they're not finding an actual answer, but they're predicting what someone would expect to hear with these kind of models. So when we talk about hallucinations, that's all these models do. They hallucinate and predict. And as we're getting better, we're making these models share with us where they got this data from. And so that is exposing the sources, which I think is what we're all kind of really interested in. Now, I think it's important to also recognize that they've been trained on things that already exist. And so bias exists there. And you can see this model, whether you use Jane versus Jim, worked as A, you're going to get a very different probability or prediction model. So if you have Jim, you can see here, most likely it's going to predict like businessmen, policemen, and fishermen. And for Jane, it's going to predict more secretary, nurse, et cetera, which, you know, highlights the need for us to think about these models and what's been built into our systems to date, so we can think about mitigating some of these biases. And now if we think about generative AI, I like this quote. If any of you have heard of Ethan Mullick, he's really a thoughtful forefront on the thoughtful forefront of generative AI and artificial intelligence, and is producing a lot of work out there in terms of tools that we can use as educators and a lot of really important information. And I love one of his quotes: "Today we have the worst generative AI tool that we'll ever have." So things are rapidly progressing, and right now what we are using is not what it's going to look like in 5 years, 10 years, et cetera. And so as we get used to using these tools, we've got to influence how they are and how we can make them better for us. One of the questions that people always ask, or the concerns that we have, is what's the role of generative AI in healthcare? Is it going to replace our jobs? What does this look like for us? And I think you know, most of the books that I'm reading are saying that hopefully it will allow us to do the things that we love more often. Maybe it can replace some of these mundane tasks, some of the easy things that are able to be replicated in high quantity, and allow us to actually spend more time at the bedside. These AI engines don't have arms, they don't have legs, they can't touch humans, and people, I think, are still gonna wanna come and see us. And Eric Topol has a nice book that I was just reading called Deep Medicine, and exposes a lot of examples of using artificial intelligence in medicine for things like reading radiology images. Right now in our hospital, probably in yours as well, there are more MRI images that are required than our radiologists can actually read. And so how do we take off some of the easy things to allow them to focus on the ones that are important and really require a human being to interpret them and sort of make sense of that? And I think that is one opportunity that people are exploring and have already been exploring for things like CT scans and others. And then if you think about in education, Sal Khan just put out this book not too long ago, which talks about how AI can revolutionize education. And for those of you that know the Khan Academy, the goal is to basically democratize education and make things available to all people on this planet. And AI is no different. So they've developed a Comigo app where they provide intelligent one-on-one tutoring for their learners. And I'll go over a little bit of that in later phases. But could you imagine if every student on this planet had access to a tutor? No matter how poor you were, in which region you were born, and AI may be a solution for some of these. Obviously, there are some challenges associated with getting access to that. And the way I kind of think about AI, this example from the US Department of Education was really, I think, thoughtful for me, and I really liked the application of this. AI is kind of like an electric bike, with AI being the battery. You still require a human to be sitting there, pedaling, directing it in the right way. But the battery helps us do our work easier, more efficiently, more quickly, without getting as tired. And I think that that is the way that if we can use AI smartly right now, that will help us to do our tasks and to do our jobs. If you think about this as the same article looking at teachers, I think we can probably apply this also to medicine. They looked at the average working hours in a given week and how many hours were spent actually interacting with students. And you can imagine interacting with our learners or interacting with our patients, it was less than half the time. And ours is probably even smaller than that. So if we could buy back even a bit of time, taking off some of those tasks that we're doing right now that aren't allowing us to get at the bedside or getting us in front of our learner, wouldn't that be really, really amazing? And I do think that that is an opportunity that we will have. And if we think about healthcare, I already mentioned some of the radiology. Pathology is also using AI to look at slide images and read pathology scans. There's AI scribes. Many of you probably have those in your clinic or have tried them in the hospital. And so it's coming, and there are ways that we can influence how this is done in the clinical environment. But we also have to be careful that AI is used properly. This is an example of a published paper, and it actually made it through all the reviews and went through publication. And if you look at the introduction, certainly, comma, here's a possible introduction for your topic, colon, and then it provides the actual introduction. So this was published in 2024. But the peer reviewers didn't catch that. The journal didn't catch that. This made it all the way through. And subsequently, thankfully, this article has been redacted because it says the authors appeared to have used generative AI. So I think when we think about research, there's a lot of questions that come up about how we should be using this. And I'll talk a little bit about this at the end. But I think it's important for us to be using some of these so that we can also recognize when this is happening and when it's appropriate and when it's not. So moving into that, how do we use generative AI safely and effectively? And one of the big concepts that a lot of people talk about is called the human in the loop, and that generative AI should not just be put somewhere and run and function on its own, but it has to be done and utilized with a human interacting with the tool, giving it prompts, giving it direction, then looking at what comes out of it, and then making sure that that's accurate, making sure it's doing all the things that we want it to do, and kind of going back and forth, iterating throughout. And that we also have to recognize that generative AI has what's called a jagged frontier. So for certain tasks that seem to be equivalently easy or difficult, these generative AI tools will function better or worse. And so there are some tasks that might appear inside this frontier, and there are those outside of the frontier. And there are some weird things that come up, like some of the models can't count letters in a word very well, but they can generate lots of words and create these incredible sonnets that are very creative and very interesting and effective. And so understanding where those lie and making sure that you have the knowledge to double check that is really, really important. And, this is it's a little bit old now. This came out in January 2023 from UNESCO. And they sort of put a process of when it should be safe or unsafe to use ChatGPT, for example. And so I start on the top, and the next phase it says, does it matter if the output is true or not? Let's say in medicine, it's probably always yes, right? So we kind of move into that right-hand side of this, this flow curve. Do you have the expertise to verify that the output is accurate? If yes, then you move into, are you willing and able to take full responsibility for any missed inaccuracies, etc.? And if yes, then maybe it's possible to use ChatGPT. So if you are an expert and you're using it for something that you know a lot about, and you can verify that, you have the time to verify that, then maybe ChatGPT or these generative AI tools could be helpful. And if not, it's probably not something that we should be using for our high stakes environment. And I mentioned Ethan Mollick earlier, and if any of you use Substack, he's got a really great Substack that you can subscribe to called One Useful Thing. And this was something that he published in January, or a little bit before January, but it talks about 15 times that you might want to use AI and 5 times you may not want to. And so you may want to use it if you just need to replicate things and you need a lot of them. So if you need quantity, if you have the expertise, if you needed to summarize something or translate what was written somewhere into a different type of output, it might help you be creative and get unstuck. He often talks about the best available human. So if generative AI is better than the best available human you have access to, you may want to use that. And thinking about different things that are ritual, standardized, where AI really is in the sweet spot might be helpful. But if you look at the 5 times where he said it's not going to be terribly helpful, if you need to learn or synthesize new information, we know that learning is hard, right? And in order to learn, you want to make that desirable difficulty. And so it's a little bit challenging to try to use generative AI to impart learning. But it can help us be more creative in our learning processes. And how do we generate better things to help our learners get through those components? I already mentioned the accuracy. So if there's a high degree of accuracy, maybe that's not the best. If we don't understand some of the failure models of AI, when effort's the point, right? So sometimes in a creative writing class, you want people to learn how to write. Generative AI is probably not the right tool for that, and where AI just doesn't do the job well. And so if we kind of take a step back and every time we use that, think about, is this the right tool for what we're trying to do? That can be helpful for us to think about. And I wanted to just share an example of some of the challenges. I always found this impactful when I was getting started to see examples of how people were using it and kind of highlight some of those limitations of AI. So I put a prompt in, this is in Copilot. I'm a doctor trying to teach medical residents about the brain and the functions that each part do. Please create an image of the brain and label each part with the name of the part and the function it does. For example, label Broca's area, speech production. Now you can see here, this is absolutely ridiculous, right? There is no brain part that actually is a real part of a brain. It's not even using English most of the time, and I'm not sure what half of the stuff is about. And you can see I asked it to generate it multiple times, and on the right-hand side, it was no better. It just really didn't work for images and medical kind of things. Now, on the other hand, if I asked it to create a table instead of an image, it actually did a pretty good job. So it created this whole table with a part of the brain. You could argue brain part is probably not what we typically might label that. So you might be able to edit that. And the function, generally this is pretty good. And so if you were, trying to prep and you needed something that you could work off of and edit, this might be a nice starting place. Whereas the image generation, especially for medicine, is not great. And you probably have all been seeing as you use Google that these AI tools are being implemented here. So I tried to go in and put Broca's area function, and you can see it's going to pull a lot of, it's going to summarize a lot of the materials that might be coming up in your search. And if you click on this, it will highlight actually where it got all this information from. So you can click on that specifically. And if you click this export button, it will actually export it into something that you can take and paste into something else. And it will actually highlight where each part came from with the sources. So you can look and verify, are any of these sources accurate? Or would be helpful for you to send to your learners. And you can see here, it's pretty limited because it's going to be searching things that are freely accessible. So not a lot of our textbooks are in that corpus that are readable at this time. So, we have to take that for a grain of salt in medicine, but these tools are getting faster. Our students are going to be using them. And so it's helpful for us to understand the limitations and maybe how we can teach them how to use these more effectively. And so how do we begin to think about using these kind of tools as health professions educators? This was a recent scoping review that just came out in 2024 that looks at the use of artificial intelligence for medical education. And as you can see on the graph on the left-hand side, there's really been this growth and explosion since 2018 in terms of the numbers of papers that are published. And as you look at where they're publishing and the level of medical education, UME is about 50%, but then GME, CPD, and others kind of mixed. So it's growing. So there's a lot of places where people are using these and publishing these. And you can see the medical specialties that are represented are broad, both in the preclinical years as well as in clinical sciences across a lot of different domains and specialties. And so it's out there. People are really starting to think about the publication of these type of things. And as we think about how these have been applied, they've been applied in a large number of ways: recruitment, teaching and instruction, assessment of our learners, clinical reasoning skills such as virtual patients, automation of cases, knowledge, and performance on medical exams. These are all ways that these kinds of tools have been studied. And so if we take a step back, I wanted to provide a couple of examples of how we might use some of these different tools for various examples. And so here's just the interface of ChatGPT-4. And I typically think of generative AI can be helpful as a collaborator, graphic designer sometimes, teaching assistants, tutors, personal assistants, and research assistants. I'm going to leave the research one separately because that's probably a whole talk in itself of how do you use this effectively to summarize literature. But there are tools like Research Rabbit and others that are out there that can be used. So if we think about a collaborator, and again, using this as your best available human, it can help you brainstorm ideas to improve creativity, allow you to save time to do the things that you love. And we do this through what's called prompting. And so that's where we basically tell these models what persona they have, what identity that they're trying to replicate, what tasks they need to do. And if we can be really specific and give restrictions, they'll actually be more creative. As an example, let's say back when Nike was coming up with their Just Do It slogan. Could you imagine if you asked it to create a slogan to sell some shoes? It probably would have created a wide variety of very vanilla type slogans. But imagine if you said, I want it to be 3 words, easy to understand, and be actionable. It may have come up with something more similar. So the more specific that you can be for these particular tools, the better off they will be to help us with creative processes. And if we think about, as we're prompting, there's a bunch of different frameworks that you can use to think about how do you set up a good prompt, because prompting is really the key to using these effectively. And so this is a paper that describes, you've got to guide the model, be explicit, ask for lots of options, assign the characters, tell them the format you want to use, provide examples, and then iterate. I like this prompt framework for the obvious reasons, but it kind of just goes through some of the tasks and roles and different components that you might put into a really effective prompt. And I'll just say, raise your hand if you've ever used generative AI for a presentation or a lecture. No one. All right. Excellent. Well, I'll share some examples. Yeah, maybe. All right. So, you can use it to help you be creative. I'm not very creative in titles. I'm terrible in thinking of those. So for this lecture, I actually thought, this would be a very good meta. I'm going to try to use it to create some of the components for this talk and just see how good they are in terms of title, learning objectives, descriptions, and, if you needed multiple choice questions, images, etc. And so here was the prompt I put for this talk. I'm giving an education grand rounds to a group of, and I spelled terribly on here, healthcare professionals, educators about utilizing AI in the healthcare education space. Can you suggest 10 potential titles? And the first one actually was not too bad. I sort of took it, I modified it a little bit, added in professions. The rest of them, many of them are pretty bad. But you could imagine sort of taking a piece like, oh, I want to use the word future, or I want to use the word partner. And so you could ask it to say, all right, give me some other thoughts, and you can use it to be pretty creative. And here, asking for 10 titles or asking for more than one things will help it to generate more of those. And you could ask it to do 10 more, 10 more, 10 more, and it's never going to get tired of doing that for you. And it's also never going to kind of replicate, because every time you run a prompt, you're going to get a different answer. So that's where one of the challenges lies with us in education. I think we want to have our learners have a more consistent approach. And it's not going to be that if we use generative AI tools. You're going to get a different response from every time they run, which may be okay. It may be more human and natural, like what we would get in real life. But this goes to number 3, asking for lots of options. And then I gave it some encouragement. ChatGPT will perform better if you provide encouragement. And it will also perform better if you tell them you're in a time pressure, if your job is threatened, if you offer to pay it money. It will actually perform better and give you less sort of variance, and will actually do a better job. There's some weird things that probably the people that were programming these networks liked various, like Star Trek. Like if you ask, there's a couple of like really funny instances of different things on YouTube that if you pretend you're a Star Trek character or ask for specific things, it will do better as well. But there's a lot of weird nuances to these tools because they want to make you happy. And so if you provide them with encouragement, and then you ask them specifically what you want. So I want you to draft a 1-paragraph description and some learning objectives. And I want you here, I asked for them to give me 10 options and use Bloom's taxonomy. And I gave them some examples below. I will say they were meh. They were better than nothing. They were good to start in terms of editing, but it did save me time. Instead of sitting there and thinking from scratch, I could kind of take a few of these and edit them and kind of go from there. I asked it to create this image, and probably when you looked at this image the first time, you were like, okay, that's just some kind of clip arty or thing. But then when you look closely at these images, I don't know about you, but none of the brains that I look at really look like this. So they're not accurate in terms of that. And so if it doesn't matter, going back to the UNESCO, it doesn't matter if this brain is perfect. For this talk, probably not. But if I was doing a talk where I actually needed to see what the brain was, this would absolutely not be acceptable. And so it's important to recognize those limitations. And this is kind of how I got there. I asked to create a futuristic style of a radiologist reading a CT scan. And this was really too futuristic. I don't know what is going on in this room. And so I thought, well, all right, maybe that was too far. So non-futuristic image. So it gave me someone sitting at a desk. Of course, interestingly enough, gave me a white male. And so I, asked for it to make the radiologist a woman of color. Which, it did. And then I wanted it to be an African-American woman or a Black woman. And so I asked it to prompt there. And, it changes that and will change the components in it. So you can actually sort of improve diversity, and you can really kind of customize it. I also thought, why is there a skeleton in the CT scan room? That seemed very unusual. They just throw parts into these healthcare things. So you can highlight it. And say, remove this skeleton, which it did. But then the bed clearly is not a bed that's going to go into a CT scanner, right? So then I asked it for it to move the bed, and it did a pretty good job. But you have to pay attention to each of these, iterate on that. And then I thought, this person is not going to be reading scans in that CT scanner. So I asked to create a separate room, which it did, with a weird kind of glass fixture in the front, and that wasn't accurate. So I asked it to make it a window here, and then it just started changing things. And so I realized that was probably the limitation of what I might get from this image, and called it done. But this just highlights that with some iterative prompting, you can probably get something that's more close to what you're looking for. And if you were to try to grab something that you had to make on your own, first of all, I don't think there's anybody in the room that probably has the skills to draw something like this. It'd probably be expensive if we all had to buy Adobe stock or other kinds of images. So this may be a way for us to put some images that are reflective, as long as we're cautious. And actually, the scan of the patient looks not unreasonable for a CT scan of the chest. So not too bad. So expose some of the limitations there. If we think about as a teaching assistant, I think this is where, there's a lot of opportunities as helping us to be even more creative as we think about creating exercises, especially active learning exercises for our learners. And this is a freely available tool on GitHub where you can go, and this is for non-healthcare professional educators. But Ethan Mullock and his wife Lilach have created a series of different prompts that you can take and adapt. And this is a lesson planner, an interactive explainer, and you can go in there and you can sort of take these prompts and you can modify them for your students. And the goal is that, you know, some of these will provide tutors for your students. So I want you to tutor my students in X, but I don't want you to give them the answer, and I want you to, you know, prompt them one question at a time. And this tool will help them kind of think through different learning processes, and you can take some of these prompts and actually create your own custom learning solutions. And I'll show you a little bit about that in 1 second. So this is a nice place to start. It's certainly not perfect for our use cases. But if you think, there are a lot of people that are taking these kinds of prompts and putting them out there as custom experiences. And if any of you purchase ChatGPT 4, there's this section on the side that's called Explore GPTs, where you can dive in. And it's all of these tools that people have created for free use. So the one I was going to share with you, and you can also create your own, which I'll show one that I've done. This is the one from the Khan Academy. It's called Tutor Me. It's a partnership that they had with OpenAI, and they created an interactive tutor that's designed to not give answers, but to help the student learn in an iterative way. And so I went back to my Broca's sort of brain function example and said, I need to understand what the various parts of the brain perform. Understand what the various parts of the brain perform. Specifically, I like to find ways to remember each part and their associated function. So then it basically came up with a way to say, all right, let's solidify the knowledge. It gave me like a list, and it created actually mnemonics for each brain part for me to learn, and matched why it would help me remember things. And it gave them there, and it asked me to read them and sort of learn them, and then asked me to answer some questions. So it generated a bunch of questions for me to test my knowledge. And yes, you could go back up and sort of see that and cheat, but you know, the process of doing so, you're probably learning, test enhanced learning, et cetera. And then it sort of would give me examples when I got it wrong, like, good try, this is close, and you probably were confused because it does this, which is similar to that one. So it goes in and sort of really explains, like a masterful tutor might do. And so it was pretty creative and very helpful. And then again, images were not great with this one. So I asked it to create a diagram just to see where the limits are, you know, this whole jagged frontier component. And so images were not something helpful, but the text was really quite great. And so you can see here again, it tried to create this brain diagram, which the text was matched pretty well with the function, but not in any sort of like visual depiction. And then I decided there's another one called Deep Game, which is supposedly sort of a narrative tool. And I thought, well, you know, let me give a chance to see how this might work. So I'm a doctor, and I want to create a game for clinical reasoning. And it decided to put me into a modern emergency room and asked me what I would do next, gave me a prompt. I didn't actually type anything. And then it asked me what I wanted to do. I want to get an EKG, creates images. Now, you know, most of our patients don't hold their EKGs for us to read. So there's some kind of funny components here. But I think if you can kind of get past that, it sort of says, you know, it's really prompting along a scenario that's somewhat basic. And it asks you what you would do next, and takes the patient to the cath lab. And again, there's some weird things like tinctures and other things that are on the table. But I think what this does is exposes opportunities for us in the future to get more creative. And if we could actually control a bit of what is going in there, which is what a lot of these tutors are doing, we can control what's in so that what's coming out feels more natural, feels different. So you could run similar scenarios over and over, testing certain things, but might feel different at each time. So that variability that comes out of that could be quite interesting. And so one of the things that we're working on, which is you know, not ready for production, but we'll put it on Open Pediatrics when it's finished, is called MedTutor. And so here we got a grant from the Celiac Disease Foundation to develop this for celiac disease, which hopefully as we build this out, we'll be able to expand it to other types of disease processes. That's the goal. And what we can do in the back end, so here's an interactive chat. that you can work with talking to the patient. You can also talk to the parent here in a very natural way. And then the back end, we can actually put in what we want the learners to know. We put the context, we put the medication, we put what learning points that they have to get, and it generates sort of a more natural feeling conversation as compared to our old, I don't know if any of you ever did some of these cases and branch scenarios. It was really like structured. This just feels a little bit better in terms of learning, but still comes with the component of we're designing what's in the back end and what's going to be exposed. You can feed in a lot of these engines. You can feed in practice guidelines. You can feed in textbook chapters, et cetera, to have that as the background for these particular cases. So more to come on these. I think we're not the only group that is doing these. There's many other groups that are building these kinds of processes. A couple that I've seen that have been really creative are ones to actually have conversations with patients and for difficult conversations, maybe end of life conversations, vaccine hesitancy, others. And if you can imagine sort of doing that in a way where you can get an automated objective scorecard. So a lot of these groups are sort of looking at in terms of facial expression, it can tell what the patient's or your facial expression looks like and might give you tips that are more objective than if you were with your mentor or with someone that you knew. And there has been some data, and Eric Topol in his book described a little bit where patients are more likely to chat with automated chatbots about things like mental health than with their own providers. And similarly, if we can provide very objective, detail-oriented feedback to our learners, maybe that could help have some of these conversations. So I think a lot to explore in that space. And over the next 2 to 5 years, we'll be seeing a lot of these things emerge. If you are interested in going and creating your own custom GPT, this paper came out in Medical Teacher in January of how to actually get in there and sort of create your own GPT. So just as an example, I don't think it's great, but I tried it to create a mechanical ventilation assistant for my learners. So I wanted it to help prompt how they might start setting up the ventilator for different cases. So I put in this is just a little bit of an example. I'll go kind of in the middle. I asked it to kind of go through all the different components, and you can just see it running right here. So potential complications to monitor, and then it says, let me know your thoughts on these settings and how you would approach this child with ventilation. And let's see, I was trying to think about what to ask. Right, let's start with PEEP. I know that normally we have trying to think. And then it sort of asked me, why might we use a higher PEEP for this particular situation? I'll just kind of speed it forward a little bit. And then how do you balance not doing too high of PEEP? And it sort of says, oh, you're on the right track. Managing PEEP and PRDS is crucial because of, here's some key considerations. And I had fed this our PALIC 2 guidelines, which is our pediatric ARDS guidelines. And so it was pulling from there and providing an intelligent tutor for our learners that they could ask questions back and forth and kind of discuss the guidelines and discuss management. Now, this obviously would have to be validated for real time, but I just wanted to see where we were, in terms of the strength and possibility for these kinds of tools. So obviously more to come in that space. And here's where you would create them. And this is what the mechanical ventilation assistant looked like. And so just setting that up there. And you can share it with just yourself. So you don't have to share it broadly and no one else can see it. So you can test it with your learners. You could do some studies on that. You could provide the link there. I also wanted to think, this probably is controversial, but could I set up right now, when I craft letters of recommendation, I have my assistant just like pull in their ARIS number and sort of, or AAMC ID and sort of like put it on my letterhead and get, the letter kind of set up so that I can actually type all the things in there. And so I thought, well, this takes, this person a little bit of time to kind of do that. Could I set up something automated so that it would have all the parts that I want, so I could go in and just set that up? And so here was just a GPT that I created and said, I typically like it to be set up like this. Here's the salutation, dear XX. You can see I just put in institution, letterhead regarding this person's name. And so it set it up as automated. And it was, I don't know, it was not bad. Certainly I would never use this to generate a letter of recommendation with any sort of meaningful components in it, but to set it up, and all I have to do is go in and push enter, and it will generate this out for me in basically like, 5 seconds, rather than having to email my assistant and whenever she has time to like get it to me and on this paper. So I thought this could be time saving, although I think we should be careful in terms of things like letters of rec, because if we are not putting our valuable expertise into those letters, then they will become essentially meaningless. And probably many of you that are reading letters these days and personal statements, you wonder how many of them have been written by GPT and others. So I put this in as a token of caution for us all to think about and probably to discuss. Dr. Hlamik had just wanted me to mention a little bit to you all about Open Pediatrics and what it was, and I'll share with you a couple of ways that we're using translation or generative AI for our translation. So Open Pediatrics is an online platform. We get a lot of learners from mostly all around the world, and we've got about 128 countries per month use this tool. So as you can imagine, we have the need for a lot of languages to be included in the content that we're putting out there. We deliver most of our content on YouTube, so anybody can access this, and so it's being delivered to patients, to healthcare professionals, and we have a lot of podcasts. And so the need to sort of think about how do we deliver content that is even more accessible to learners was an important thing. And although we have a pretty big team here of videographers, animators, illustrators, this is not, we don't have enough people to have a lot of capabilities to sort of spend time on just translation alone. So we launched a campaign about a year and a half ago where we asked people to help partner in our translations, where we took our videos, we ran them through a generative AI tool, and then asked our volunteers to help us edit and correct our transcripts. Because, as we've seen before, for medical stuff, they're not great. And it's been really helpful. We've done 70 translations in a pretty quick fashion across 23 languages, many languages that we probably wouldn't have focused on if we had a need, but they said that they were using it in their hospital, and especially their nursing staff didn't speak English as much as their physician staff, and so they wanted to do certain videos for their teams. And if you look here, we asked our translators to say how long it took them to actually correct the transcripts. And typically for our videos, it would take hours, maybe 4 to 6 hours to translate a 15-minute video if we were starting from scratch when we used to do that, early on. And here you can see a large majority is less than 60 minutes to go in there and just correct the transcript that was done versus starting from scratch. And there were certainly some outliers, probably for different languages and different skill ability. But this just showed a way where maybe we can leverage these tools to be helpful, although we still kept the human in the loop to make sure that these were accurate. Now, YouTube is doing this for other languages already, but within medicine, it's not very accurate. And when you want someone to be, doing something that needs to be accurate, I think it's important. So this was just one example of the way that we were using it. The other big opportunity I think that we have within the healthcare profession space is within learner assessment. And so imagine if we could help this draft questions that we would then edit. Questions take a long time, and you can set it. I want it in case-based style, following these particular processes, and it might be able to get us at least started on some of these questions, providing feedback for our learners, thinking about accessibility issues, and maybe making our learning and our teaching more efficient. And one of the real challenges I think that we all face within learner assessment and sort of thinking about how to evaluate our learners is all the different sources that we have coming in. We've got scores, we've got numbers, we've got data, we've got written text, we've got milestones. How do we bring this all together and summarize? And although generative AI and some of these AI tools right now is not great with numbers, I imagine that this is something that's probably going to be coming soon. There was a really cool program at Mass General in their anesthesia residency program where they took all of their learners, they looked at all their written evaluations, and then they did basically a thematic analysis where they identified what were positives and what were negative kind of comments, and they tracked all of this. And then they looked at each learner and said, all right, well, you have these things in the positive, these things in the negative. But what was interesting is they had all these places where there were notable absences. So, nobody commented on your medical knowledge. And as a learner, you might sit there and reflect and say, well, maybe no one commented either because it's not good, or I might need to show that more. And so it kind of provides a more objective way to sort of look and provide different kinds of feedback than we ever had before. And I could imagine that was labor intensive to sit there and do all the thematic coding yourself, but a tool like generative AI may be helpful. Now, I think it's important to recognize that we wouldn't want to put any of these into any open model because anything we put in there is accessible. And I'll share with you what we're doing at our hospital, and trying to protect, this kinds of data, because I think we've got to make sure that it's safe and secure, because that would otherwise be really exposing our learners to some vulnerabilities. So if we think about ethics, there's a lot of ethics that come into play. I won't go through all of these in detail, but we talked a little bit about bias. We talked about resource allocation. There's ways, cybersecurity, confidentiality, transparency. There are many things that come into ethical issues. I did want to go into just a brief moment on what do we do for paper writing? And let's say we want to write a paper if we're an educator. What is currently the thinking about using these tools? And so the International Committee on Medical Journal Editors have put out a statement in January of last year that describes what they believe to be the current best practices for using AI in manuscript writing. And obviously the first is that you have to disclose if you're using this in any sort of way. And you should disclose it both in the cover letter as well as in the appropriate section of the manuscript. They should not be, generative AI should not be an author. They weren't doing anything that's their own creative endeavor. They're just using their model. And that we have to carefully review and edit anything that comes out if we're going to use this. And we have to make sure that there's no plagiarism involved if we use these tools. I personally wouldn't use these for writing anything at the moment, but if people are, these are sort of the guidelines. Peer reviewers also, many journals have come out to say we do not want you to input these manuscript submissions into these open models because it does go openly into the model. And so, Peds Critical Care Medicine, our journal has said explicitly if you're a peer reviewer, you're not to upload these or use these kind of tools. And I think if the journals wanted to use a generative AI tool to generate a peer review, they probably would just do that themselves. And so they're reaching out to peer reviewers because we have expertise and that they're looking for that particular expertise in terms of reading those. And so I think it's important to recognize that. And most of the journals are very similar. So I just pulled some of the higher tier journals. So the New England Journal of Medicine has a similar approach. You can see the guidelines there. They even refer back to the ICG of MG guidelines, JAMA Network, the same thing. Nature, same in terms of authorship, etc. Any images, AI images are not allowed in Nature, for example, not allowed in peer review, etc. And there are a lot of questions about how do we as reviewers then, with that example I shared with you in the beginning, how do we test whether or not these are being, any of these tools are being written by these machines? So there's a couple papers that are sort of looking at that. And, I think here is an example of looking at JetGPT 3.5 versus 4.0 and whether or not these machines can actually generate or detect whether the abstracts were written with AI. And you can see here, as the models have gotten evolved, they actually are saying that it's unlikely that they're AI generated, although based on probably how much people are using AI, it's probably more likely that people are using them. And so I think, that the models are likely getting better. And as long as people are using them to edit and refine them, it's going to be nearly impossible for any of these AI checkers to detect whether or not papers are being written with these models. So I think it's unlikely we're going to have a solution other than what we all agree on and what we think is the right way to do that, because these models are not going to be able to no longer detect these little nuances of AI. So kind of in conclusion, I'll kind of bring a couple of things. So as generative AI hyperreality, for many of you, you probably have heard the the Gartner's hype cycle, where you've got a technology trigger, and then there's this peak of inflated expectation, which is where I think we probably were last year, and then this trough of disillusionment, and then finally we figure out how best to use it. Maybe we're here. Some people might fall in different phases along this line, but I think there is some excitement around it, but we're sort of recognizing those limitations of AI even more as we're using it more often. And as we think about institutions, how do we generate ways that we can use AI effectively, or teach our staff and all of our learners how to use AI? So I think, there's a big role that we have to make sure that we're understanding, reviewing the strategies, providing effective teaching and training on these models, being stewards of ethical AI use, and then providing support for our faculty. And so I think there's recommendations for us as educators and recommendations for us as institutions. This was a great paper that came out in Academic Medicine last year about how we can use that. And at Boston Children's Hospital, I just wanted to kind of leave with the way that we're thinking about using this. So these are slides courtesy of Dr. John Brownstein, who leads our Innovation and Digital Health Accelerator. So we have an AI governance committee, which I sit on, and we look at how do we provide generative AI safely throughout the hospital. And so we provide a specific instance. We have our own ChatGPT instance that is HIPAA compliant, that we can put actual materials in there that applies with our data governance policies. And so it doesn't go out into any other model, it's within ours. And so that's been one huge advantage that we have. And then we also have tools and access to OpenAI for our learners for our staff, that they can come to this group and sort of see. And so our current policies, we provide specific models that are approved for use and not approved for use. So if you're doing anything within the hospital base, they ask us to use the BCH models. And if you're doing stuff for non-sensitive tasks that don't involve any PHI or confidentiality, educational purposes, we can still use the other models there. And they've been rolling out a lot of education and training for our staff. So providing risks and considerations. So making sure everybody's aware that incorrect information can come out, that there's false sources, bias, data privacy considerations, et cetera. So all of the big things, this whole concept of human in the loop that I talked about before, and that you've got to be involved in all those components. We have been doing a lot of capacity building and AI literacy with a series of webinars. And then coming this year is going to be a bigger, broader toolkit and resource hub, office hours, prompts of the week, ambassador programs within our departments. We've got small-scale innovation support for people in the hospital that are looking to do small-scale tasks, as well as the large enterprise-based approach. And so really kind of trying to mitigate the risk of people using it within the hospital while still fostering innovation. So more to come in there. And then I just wanted to leave with a quote: nothing in life is to be feared, it's only to be understood. So hopefully we can begin to understand the limitations and what AI can do for us. So happy to take any questions as well. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.